Welcome to our channel Examine the BDS. I'm Dr. Dinesh. As I am having severe cold and fever, I could not post videos for the past few days. Today we are going to see about Aerodontalgia and Odontocrexis. Before that, I want to first congratulate the Indian Air Force for acquiring Rafale fighter jet. These are the Indian fighter pilots who brought it from France. It has a top speed of 2222 km per hour and a range of 3700 km. When fully loaded with weapons, it looks somewhat like this. Now let's see how this relates to dentistry. Aerodontalgia is a toothache resulting Aerodontalgia is a toothache resulting from atmospheric decompression. It is a condition in which barometric pressure changes in the external environment causes dental pain. Clinically, this condition is similar to pulpitis pain. It was first reported in flying personnel during World War II. Not only in fighter pilots, it can also be seen in common people flying at high altitudes, and can also be seen in astronauts. Now let's understand how this occurs. For this, you should first understand this graph. Pressure is always inversely proportional to volume. Look at the first dot in the graph. Here, due to high pressure, that is 120, the volume is very low. Similarly, as the pressure drops, the molecule expands. For example, the last dot. So as you see in this picture, the higher you go, the pressure decreases. And because of low pressure, the air molecule expands. When talking about teeth, this problem can occur when a small void is created within a filled tooth between the restoration and the tooth structure. Aerodontalgia is also called as barodontalgia. It is a symptom and not a disease. Common oral defects which causes aerodontalgia are dental caries, defective restoration, pulpitis, and even mucus retention cysts. Any air left between the restoration and tooth may expand, giving pressure to the dentinal tubules and pulp, which creates pain similar to that of pulpitis. Treatment involves removing the void space carefully and replacing the offending restoration. Sometimes a RC-treated tooth may give pain due to a void present at the apex. In such cases, we have to repeat endodontic treatment. Sometimes treatment also involves the extraction of a tooth. It can be concluded that pulp diseases are the major causative pathology of aerodontalgia. One clinical benefit of aerodontalgia is that it can help dentists locate early caries and leaking restorations. It is suggested that for people who are subjected to large pressure changes, it is best to avoid procedures like direct pulp capping. Rather, an endodontic treatment should be indicated. Now let's look at odontocrexis. It is a term used to describe restoration and tooth fractures caused by a high altitude environment. Its mechanism is similar to aerodontalgia, but here there is physical disruption of inferior quality restoration or tooth structure due to the expansion of gas during barometric pressure changes. There are even incidences of dislodgement of crowns. For this, we have to carefully restore the tooth with high strength material without leaving any voids. And we have to fix the crown back in case of dislodgements. There are some cases where we can see aerodontalgia symptoms with no dental findings. In such cases, it might be aerosinusitis and we must refer them to ENT specialist. This topic ends here. Let's see today's bonus fact. Men's testicles hang below their body because sperm dies at body temperature. If you like this video, share and subscribe our channel. Thanks for watching.